welcome to Group 9's presentations on galactosemia, an inherited metabolic disorder. My name is Narishika Bint Amiruddin, and today we will go through what is galactosemia. Before we go through one by one of this slide, I would like to introduce my team members. Firstly, my name is Rashika, next is Adawiyah, third is Steven, next is Ali, and lastly is Lokman Al-Hakim. Galactosemia is a rare genetic disorder where the body cannot process a simple sugar called galactose. Galactose is one of two sugars found in lactose, the sugar present in milk or dairy product. When someone with galactosemia consumes milk, galactose builds up in the body and becomes toxic. This disorder most commonly appears in babies and children, especially after breastfeeding or consuming formula. Galactosemia is passed down through an autosomal recessive inheritance pattern. This means a child must inherit two defective copies of a gene, one from each parent to have the disease. If both parents are carriers, there is a 25% chance their child will have galactosemia. The gene most commonly involved in galactosemia is called GALT, which stands for galactose 1-phosphate uridyl transferase. As shown in figure 1, this gene is found on chromosome 9. When this gene has mutations, the body cannot produce the GALT enzyme needed to process galactose, leading to type 1 or classical galactosemia. There are three main types of galactosemia, each caused by a different enzyme deficiency. Firstly, type 1 or classical galactosemia, caused by GALT deficiency. Next is type 2, caused by a mutations in the GLK1 gene leading to galactokinase deficiency. Lastly, type 3, caused by GALE deficiency, which affects the enzyme UDP galactose for epimerase. Next, in type 2 galactosemia, the body lacks the galactokinase enzyme due to a GALK1 gene mutation. This type is generally less severe than type 1, but it can still cause cataracts in babies. This happens because excess galactose is converted to galactitol, which builds up in the eye lens and causes cloudiness. Lastly, type 3, symptoms can vary but may include liver problems, muscle weakness, and developmental delays. It is usually milder than type 1, but some cases can still be serious depending on how much enzyme activity is lost. That's all from me. I will pass to the next presenter, which is Ali.
After we consume lactose through dairy products, it's going to be broken down into two, glucose and galactose, through an enzyme called lactase in our small intestines. Then after that, through certain transporters, these two are going to go out of the small intestines all the way to the bloodstream, then to the liver, where our galactosemia occurs. Our biological pathway is called Lilwar pathway. After the galactose has reached to the liver, it will be in its beta form and needs an enzyme called GAL to convert it to alpha form to be used in the reaction. After that, alpha D galactose is going to be converted into galactose 1-phosphate through an enzyme, one of our three important enzymes called galactokinase. And the phosphate group comes from an ATP. So our enzyme takes one phosphate group from ATP and give it to our galactose, alpha D galactose. Then for the following step, there will be another helping molecule called UDP glucose, and UDP glucose and galactose 1-phosphate are going through our second important enzyme, galactose 1-phosphate uridyl transferase, and from its name, it's transferase, so it's going to transfer our glucose 1-phosphate into UDP, our galactose 1-phosphate into UDP galactose, and our UDP glucose into glucose 1-phosphate. Then our last step, glucose 1-phosphate is going to be converted to glucose 6-phosphate through our last important enzyme called GAL to be used in the imaging. Thank you. We have hundreds or even thousands of gene mutations that happen in each enzyme. I will explain the most common and the most severe, which is classical galactosemia. The location of the mutation happens in chromosome 9p13, The mutation itself, as you can see, Q188R, which means that our amino acid glutamine has mutated and changed to arginine, and this small change results in galactosemia. And the rest of explanation is the same for the rest of the mutations. This is a comparison between a normal gene and the mutated one. And the one thing that we can notice at the surface of the mutated one, which is in green, we can see that there is a pump. It's not smooth as the normal one.
Hi everyone, I'm Timan Sharma here. Let's talk about the sign and symptoms of galactosemia. The first one is newborn stage. The early symptoms starts within the first few days after birth once the baby starts feeding on the milk. Because of the GALT enzyme deficiency, galactose cannot broken down properly. This leads to a toxic substance buildup in the body. The common signs and symptoms include vomiting, poor feeding, and diarrhea. The baby may look tired, has yellow skin, yellow eyes, which is called jaundice. The liver also might be swollen, and in some serious cases, the baby may develop life threatening infections like E. coli sepsis. The second one is what if the symptoms are untreated? If the condition is not treated quickly, obviously the symptoms will get worse. The liver will fail, causing bleeding and low blood sugar. The kidney may also stop working properly. The baby might even develop cataracts due to sugar builds up in the eyes. And the brain may be affected, leading to seizures and coma. Without early diagnosis and dietary changes, the condition can even lead to death. The third one is long term complication, even with treatment. Even after early treatment with galactose free diet, some long term effect will still happen. This includes speech delay, learning problem, and motor coordination issues. Some girls also may face ovarian failure, leading to infertility. Some people also have experience in growth issues and emotional challenges like anxiety and depression.
So right now I'm going to share you the diagnostic method. There are three main ways to diagnose galactosemia. Method 1. Newborn screening test. This is a routine test done after birth to check for early signs of galactosemia and prevent serious problems like liver damage. Method 2. Confirmatory test. This test is done if the screen shows a problem. It confirms the diagnosis and tells how serious the condition is. Method 3 is the genetic testing. This test checks the baby's genetics to confirm galactosemia, especially if enzyme results are not clear. Newborn screening test. This test is usually done within 24 to 72 hours after birth. A few drops of the baby blood are taken using a heel prick and placed on special paper to check for serious conditions like galactosemia. If the result is abnormal, the baby will need more testing. Milk feeding is stopped and replaced with lactose-free formula. Follow-up tests like blood enzyme assay and genetic testing will be done to confirm the diagnosis. Confirmatory tests. To confirm galactosemia, doctors use a few tests. First, the GALT enzyme assay checks the enzyme activity to confirm classic galactosemia. Second, measuring GAL1P and galactose level helps assess how severe it is. Lastly, genetic testing looks for mutation in the GALT gene to confirm diagnosis and type. Genetic testing. Genetic testing is done using a blood sample or a cheek swab. The DNA is then extracted and tested using methods like PCR, DNA sequencing, or mutation panel testing. In complex cases, whole exome sequencing is used to find rare mutations. Next, the results show three possibilities. Two mutations confirm galactosemia. One mutation means the baby is just a carrier. No mutation means the baby is unlikely to have it. Why it matters for the family. This helps find carriers in the family, guides future pregnancy testing, and support genetic counseling.
Hi, my name is Lokman Al Hakim. I will present the part of alleviation of galactosemia. There is actually no current cure yet. There is only ways to lessen the symptom and effect. Now, the primary way to effectively manage galactosemia is by having a strict diet without galactose and lactose. Usually, this begins right immediately after diagnosis. For example, newborn babies need to switch to soy-based and lactose-based formula. Secondly is regular monitoring. This includes blood galactose levels and growth development tracking. Now for the second part of elevation of galactosemia, there is actually futures options. First one being gene therapy, second one is being mRNA therapy. So in gene therapy, basically they will add a good copy of JAK gene to help the body make the right enzyme again, that is the JAK enzyme. So recently it has worked well in animals. The second one is mRNA therapy. This gives the body instruction to make JAK enzyme, but it needs to be given more than once. So basically it has a period of effectiveness such as insulin. Yes. Thank you.